Is open marriage something you want?
I know you'd never...
There's somebody else.
There's a woman at work. People say she's attracted to me, but nothing's happened. I don't want to make the same mistakes.
Are you attracted to her?
She's attractive.
Aren't I enough for you?
Of course you. Our patient's lost all movement in her legs.
And Taub has lost movement in one of his legs, as his plans for a consensual rerun are about as well received as a Kama Sutra in a nunnery. Very excited to be reacting to House MD Season 6, Episode 19, Open and Shut. On this channel, we are reacting to all 177 House episodes, and this will be 130. Let's see if I can get the diagnosis before House does as a doctor working in London.
Tom, your husband.
I know I'm not supposed to be here, but Evelyn's school contract's due tomorrow.
Hey.
I'm Tom.
Damien.
I'll get out of your way. It's good to meet you, and I'll see you later, hon.
Ooh. Ow. Get Tom.
Maybe you could keep some clothes here.
Maybe I could.
He's just trying to get into your skirts. She put the milk in the door, not on the shelf. I hate that she did that, but she didn't say anything.
Interesting case. 35-year-old woman with fever and abdominal pain. ER ruled out all the usual suspects. And she's in an open marriage.
I think it's just weird. There's no other species on the planet that mates for life.
Animals also eat their young and kill their rivals.
Our patient's unhappy because she's suffering from an intestinal blockage.
I wasn't quite sure whether to be impressed or shocked at her husband's reaction. Surely a little bit of jealousy is a good thing. Territorialism and being protective comes from a place of caring. Taken to the extremes though, it leads to abuse on one side and indifference on the other, neither of which sounds like a recipe for a happily ever after, even with more happy endings. Don't just take my word for it though. One survey showed that 92% of open marriages actually fail. If the team don't open her intestine though, then she'll have a lot more to worry about than her relationship. Of course, the obvious answer is to say that this is related to her wandering trouser whiskers, but House likes obvious, like rhinos, like pom-poms, so what else could it be? The other causes for blockages in the large intestine would be tumours and small outpouchings that can get inflamed, called diverticular disease. For the small bowel, it's adhesions, which is basically scar tissue in the abdomen, and hernias where the bowel ends up poking through a defect and getting stuck. They are also a bit too common though. Spicier, more House-esque causes include things like metabolic, which is low electrolytes like potassium, magnesium or calcium, leading to something called pseudo-obstruction, which wouldn't necessarily show up on the scans. Definitely could work here. Inflammatory could be granulomatosis with polyangiitis, leading to a vasculitis and kidney swelling that's potentially pressing on the bowel from the outside, although that's quite unlikely. Degenerative could be damage to the peripheral nerves that supply the bowel through a disease called Guillain Barré. That would be an awesome way for it to present. Neoplastic could be a rare adrenaline producing tumor with paraneoplastic syndrome, although that would usually have other symptoms too. Infection could be a rare parasite from giant tapeworm, although very unlikely, especially as we've had a tapeworm before. Toxic could be an overdose of pain pills. Pretty much any opiate could do it, especially codeine. So I'd want to check her bloods, put a camera in the back passage to have a look and relieve the blockage if possible. So let's get more clues.
What about herpes colitis?
STD panel was clean.
Herpes might not register if she was exposed in the last 6 weeks.
It would show up on a barium enema.
You're gonna do it?
Tons of couples do what we do. It's just that with most of them, one spouse doesn't know about it. Things work better when people tell each other the truth.
I'm not saying I hate it, just doesn't go with your eyes.
Is she as bendy as she looks?
Maya and I are just friends. So we flirt, it's fun.
It's dangerous. If you want to be on a diet, you might want to stop hanging out by the dessert cart. She doesn't have herpes colitis.
Take her digestive system for a test drive. Give her a radio-opaque milkshake.
How long you been married?
Nobody ever asks me about current events or the weather. 7 years. After 3 years, we realized that traditional marriage was making us both miserable.
We still loved each other.
Expecting one person to fulfill all of your needs forever is unrealistic.
I don't want to settle and end up resenting my husband. I'd rather get the 10% he doesn't give me somewhere else. I can really appreciate him for the 90% he does. My heart is racing.
Try to take deep breaths. I'm gonna try to slow your heart down. It's not working. Need a crash cart in here?
I think it was Taub's heart that was racing when he realized he agreed with everything the patient was saying. He wasn't massaging the patient's neck to become her next exploit though. He was doing it because her heart was racing and he needed to manipulate her physiology. It's called a carotid massage, and it works because our body has a sensor there called a baroreceptor, which can detect pressure and help to send adjustment signals accordingly. So how does that work? Since arteries should be fairly elastic, too stretched means the pressure is too high, and it sends a reflex signal through the vagus nerve to the heart to tell it, take it easy, yeah, Azizi. I'm Arabic, so those were the first words that came to mind. So when Taub uses his overtrained hand drumsticks to apply pressure to that baroreceptor, it creates that signal even in the absence of high pressure to try and stop the abnormal heart rhythm. But it didn't work, so what do they do now? Well, they have drugs that can work instead, like beta blockers or calcium channel blockers, but if her blood pressure becomes unstable, then she may need another hot date with a guy's name starting with D, although this one ends with fibrillator. Either way, we have some more clues. We know her x-ray was negative, which House for once wanted to do himself. Her blockage and abdominal pain are gone, and now her heart rate is out of whack. Whatever disease process this is, it just seems to hit it, then quit it. Okay, so what can just come, block the bowel, then go away and hit the heart? Well, the electrolyte abnormality wouldn't really do that, as they just keep making the bowels worse if they stuck around. Unless she had a periodic derangement. Sometimes they're fine, but sometimes the potassium levels could drop. Why should she react differently each time though? That wouldn't really make sense. I mean, my paraneoplastic adrenaline producing tumor makes sense here now, to be fair, as this would be the exact next step. All right, I'm going for pheochromocytoma as my first diagnostic guess. Let's get more clues.
I need a list of all your sexual partners from the last 6 months.
It's kind of complicated.
How many partners are we talking about?
None. She needs this. I don't.
Men are genetically engineered to be jealous. Doesn't matter if I think there's a score, I guarantee you he does. He's doing something behind her back. Well, I'm better covered than a business trip to Nebraska.
When my mom was dying, my dad had an affair. I'd seen them get out of his car. 2 years after mom died, they got married. My mom never knew about it, and he needed someone to make him feel less alone. Whoever's taking care of me when I get sick, I hope they've got someone else to take care of them. Maybe they just bought their parasites at the mall.
Is open marriage something you want?
I know you'd never.
There's somebody else.
There's a woman at work. People say she's attracted to me, but nothing's happened. I don't want to make the same mistakes.
Are you attracted to her?
She's attractive.
Aren't I enough for you?
Of course you. Our patient's lost all movement in her legs.
And Taub has lost movement in one of his legs, as his plans for a consensual rerun are about as well received as a Kama Sutra in a nunnery. The team were thinking it was a parasitic infection as well because of the gut then heart situation, but now losing use of one of her legs makes that very unlikely. What it does make way more likely though is a peripheral nerve issue like sounds familiar. Guillain Barré syndrome. It's spicy, it's rare, it would explain all her symptoms, and it could even be reversible. So what is it? Well, it's an autoimmune condition which is triggered by an infection. This could start as a bacterial gut infection or even a viral infection like kissing disease, i.e. Epstein-Barr, then it triggers the patient's body to start attacking its own nerves, and it would be treated by IVIG to neutralize the antibodies and steroids to help the inflammation, and by diagnosing and treating the underlying cause. Oh, that would fit so well here, so I'm going for Guillain Barré syndrome as my second diagnostic guess. What do you guys think here about this whole Taub situation? He obviously has a hypernormal libido, and it's difficult having that satisfied from his marriage, but then he did decide to get married in the first place, which involves a degree of sacrifice and commitment to his vows. I can kind of see both perspectives here, but what's your opinion? Let us know in the comments. Now, let's get more clues.
I'm sorry. The woman's paralyzed. I'll get a cab. Tests show no spinal cord injury, no cerebral lesions, no hemorrhage. Brought up open marriage with Rachel. It was a disaster.
On the medical front, could be an electrolyte imbalance.
What about sex?
Increased libido can be a symptom of adrenocortical carcinoma.
A woman who likes sex must be sick.
Get an MRI of her adrenal glands.
Would you mind using a coaster?
Oh, sure.
And please don't throw banana peels in the bedroom trash.
I haven't done any of those things.
Oh my God, it was House.
When did you get all OCD? It's about health. What about the coaster? Does that replenish my B12 or something? You have this list of annoyances the entire time we were married?
Get better, Mommy.
Julia, you have a guest. Hi. This isn't a good time. This is our family. Sorry.
Men who have multiple copies of a certain vasopressin receptor are twice as likely to be unfaithful.
How could you think that we still had a real marriage? We hadn't had a conversation in months.
VQ scan confirmed the spot on Julia's lung was a clot.
Accounting notified you 2 days ago about your patient's insurance. He doesn't have any. Try not to bankrupt them.
Of course we have health insurance.
We're actually a little behind on the premiums.
And that's why he agreed to the open marriage, as he lost his job, spent his money on secret holidays, invested their life savings in Bitcoin. In all fairness, Bitcoin was made around 2009, which is also around the time this was filmed, so actually would have made them multi-billionaires, but never mind. We now know that she has a clot in her lung, paralysis, arrhythmia, intermittent abdominal pain, and no health insurance. The loofah they found in her house was also negative for parasites. Chase raised an interesting idea here as well. What if her libido is a symptom? Apparently she's engaging in forages between the sheets 3 to 4 times per week with her husband, and then a couple times more with other guys too. Even rabbits are thinking she needs to slow down at this point. That being said though, there is no number of times per week that is considered hypersexuality. The criteria for that, which makes it a disorder, is when it causes distress to the person or puts them in harm's way. That being said, the most common frequency of sex for married couples is once a week, although that is only around 25% of them. 5% of married couples are actually having sex 4 or more times per week, and that's a lot. But this couple won't be having any mattress explosions if we don't figure out what's wrong with the patient. A clotting disorder could potentially be doing this, but I wonder if rather than being caused by a blood issue, it's a problem with a cancer. She could have a testosterone releasing one that's also led to the clot. This could be on an ovary, then got large enough to partially block a vein while compressing it and by sending the testosterone to the blood. This type of tumor is called a Sertoli-Leydig tumor and definitely would make sense here. Either way, we may not find out unless we get her health insurance sorted. I definitely want a CA125 blood marker and testosterone levels.
I pulled money out of my retirement account. I lost all of our savings.
How did he lose it anyway?
He builds wind turbines and leases them out to local power companies.
Congratulations, House. Sam ended it.
As long as you're free. You want to grab some dinner?
When we first opened our marriage, I got involved with a guy who lied about being single. I felt superior because Tom and I are honest with each other.
You know what the worst part was? When you had your affair. It was the lies. I don't want to go through that again. Thursday nights. You have to be home by midnight.
All our tests came back negative. It's not a clotting disorder.
Taub's wife gave the green light for an open marriage.
Same pain as before?
Yeah, of course. Physical exam was unrevealing, ultrasound was clean. What matters isn't when the pain started, but when it stopped. House prepped her for the x-ray with a barium enema.
You're in pain because part of your intestine folded in on itself. It's called an intussusception.
Intussusception? In an adult? Seems like Taub's blood flows finally returned above the belt after the approval of his repeat performance. But how can someone's bowel randomly start folding in on itself? Well, usually in children this happens because the bowel wall is quite weak, and then there's telescoping, which is quite literally the bowel moving inside itself. The blood flow then starts to become cut off. In adults it's a bit different, as there usually is something else that causes it rather than it just being a thing on its own. That means a small tumor or some kind of scarring to the intestines that's the trigger. Maybe that's the testosterone producing tumor in the ovaries that's pressuring on the bowel. I do think Guillain Barré is out of the question now, as that doesn't really follow this go away then come back pattern that seems to be happening. It could also be, this would fit so well here, a neuroendocrine tumor that keeps releasing serotonin and can cause intermittent fevers, abdominal pain and arrhythmias. It would also explain the blood clot because it's a type of cancer. That would work really well. Carcinoid syndrome due to neuroendocrine tumor has to be my third and final diagnostic guess. We are locked in. But before we move on, 13 said an interesting point earlier. Cheaters are more likely to have a mutation in their vasopressin receptors. I can see why they cited that, as the study done looking into this was from 2004 by Shurkas and colleagues, but they showed that at most there could be a 41% association with genetics, but the evidence was weak and the finding was insignificant. So no, you aren't getting out of a divorce court settlement using any genetic answer anytime soon. Although I'm surprised Taub managed to get his wife to agree to this. Fair play. I mean, what a couple agree to within the bounds of their marriage is their business. As long as they aren't breaking any laws or inconveniencing others and they're happy, then go for it. All I ask is that you don't land yourself in my clinic after someone had a bright idea and got a light bulb stuck up their rear cannon. Now let's open fire onto the rest of the episode.
When this happens in adults, it's usually a sign of abdominal cancer. We'll fix the overlap and then search your intestine for tumors.
Where's Rachel eating tonight? What if she's going out too?
I knew I'd rather be jealous than a liar. Got something here?
Biopsy showed non-specific inflammation.
IBD does make sense. It could trigger ankylosing spondylitis.
I can't. I really thought I could do this. All I kept thinking about was the two of you.
I don't need anything else. I just need you. I love you, Rachel.
I love you too.
Treatment's not working. Left kidney fell last night. The other one's right behind it.
Kidney biopsy showed she had IgA nephropathy associated with any of these conditions.
Hemochromatosis is a possibility.
Wells syndrome also affects multiple organ systems.
Sarcoidosis makes sense too.
Treat for those three.
Tom hasn't slept with anyone else in over a year. Your husband, who only wants you, lied so that you could be happy.
I was just resenting you and giving you a reason to leave. Is it okay if we don't give House the credit?
0 for 3. Her kidney function is still declining. We're gonna need to start dialysis.
Guy's wife's dying. He stops to buy flowers. My mom used to grow lilacs. My dad made her get rid of them. There are too many bees.
Where there are bees, there's honey, and where there's honey, there's botulism. Is that what he's getting at? That would explain the paralysis, but really not anything else, especially the IgA nephropathy. That is when antibodies deposit themselves in the kidneys and end up causing damage to them. It's usually a response to an autoimmune condition or infection, but can also be related to allergy. Whoa. Okay, wait a minute. What if the bees stung her? The team didn't find it, but the body produced a hyperallergic reaction to it that led to her abdominal pain, paralysis, and kidney failure. How could it do that? Well, something called serum sickness. You get exposed to the allergen, but nothing happens until more than 5 days after the exposure. The body produces immune complexes that then mediate the symptoms, which can cause fever, joint pain, and rash, then even progress to full-blown kidney failure. The bowel issues could have been because of non-specific inflammation that they mentioned as well. And my favorite part is it's not related to open relationship. I do want to know though how the guy lost all their money. House conveniently said he wasn't interested to find out. 13 would be happy with this diagnosis as well, as it means the patient's symptoms are not related to hypersexuality, thus avoiding the possibility and seeing a strong female libido as pathological. How would we treat it though? Well, 7 to 10 days of steroids would pretty much get rid of it, as it is an autoimmune condition. But alas, even if bee sting induced serum sickness is the diagnosis, then I am firing blanks with 0 diagnostic guesses left, so House would still win this one. Let's find out.
We ruled out HSP because there was no inciting respiratory infection. Have you been stung by a bee recently?
About a month ago.
I think your wife has Hanoch shin line purpura. You'd have a rash somewhere. I'm gonna have to check your holes. Say ah.
Ah.
Just kind of hoping for kinky.
You should be fine. I love you.
That is adorable.
You need a hand? Sorry about canceling the other night.
You wanna go somewhere?
Taub. He saw 13 telling the patient that her husband lied to make her happy, and that gave him the motivation he needed to agree to lying to his wife. Why? Out of some misplaced idea that he's protecting her from the harsh reality that she isn't enough for him. He needs a thrill of novelty of a new relationship. It is kind of selfish though, as he values her happiness enough to lie to her, but not enough to keep up with his marital vows. So in reality, it is about as selfless as stockpiling toilet paper. We know now the patient had Hanoch shin line purpura, which I have to admit I would have never gotten from those symptoms. No diarrhea, no rash, no chance. Even with the bee sting, it would be too much. Maybe from the rash in the mouth, I could have figured it out. But by that point, House has won. I'm not seeing HSP in there. The only letter is L. House is still sabotaging Wilson, as technically milk in the door fridge spoils faster as there are more temperature fluctuations, and he's making it seem like his new lady has done it again. Really enjoyable episode. 8.2 out of 10 entertainment, 8 out of 10 diagnosis, 8.1 out of 10 accuracy. This episode doesn't make full sense to watch the previous one where a knight of Camelot falls ill.